Thoracic Flexion Assessment. To perform this assessment, you're going to need a wall or a pole that you can stand up against. So we're going to start with the back of the feet touching the wall, and roughly 1 foot length away from the wall is where we're going to place the feet. We stand with our back flat against the wall and the back of our head touching the wall, and then we want to get rid of this lumbar curve. So we're going to set the pelvis in this posterior pelvic tilt so we can push the lower back into the wall. So your butt, lower back, shoulders and head are all touching the wall. We're going to place the hands on the thighs. Now from this position we're going to start by flexing the cervical spine. We're going to go chin to chest in this position. Then from here, 1 vertebrae at a time, we're going to start to take the thoracic off and we're rounding the back. So slowly going down, keeping the pelvis set in this posterior pelvic tilt and just getting as much thoracic flexion or rounding of the back as we can. Then once you can go no further, from this position we want to start to go back 1 vertebra at a time, rolling back to the wall, keeping the chin tucked, bring the shoulders back to the wall, and then bring the head back to the wall in this position. So it's got 2 parts really. What we're trying to look at is obviously the maximum amount of thoracic flexion you have, but we're also looking at the control. How can you control, or how well can you control the vertebra 1 at a time as you go into flexion and then you move out of flexion, okay? It's best to video this from a side view because we want to be obviously looking at your posture, making sure you start with that lower back pressed against the wall and then looking to see that you can take the head off, the shoulders off, and then 1 vertebra at a time if you can, rolling down as far as possible and then reversing that motion to come back up. This is the Thoracic Flexion Assessment.